After having your baby, you may find that you need some instruction in doing pelvic floor exercises. There is a lot of information available online. Most commonly, I see people coming in and not quite knowing how to add the breathing into doing pelvic floor exercises. You must remember we relax our pelvic floor muscles when we breathe in, and we tighten the pelvic floor muscles while we breathe out. So if you can remember that breathing, that will help assist you gaining strength and endurance of your pelvic floor muscles. Ideally, we want to do 5 to 10 slow and fast pelvic floor exercises, and building your endurance from 5 seconds, building up towards 10 seconds. When you're doing a pelvic floor contraction, you want to feel the skin around your back passage squeezing and lifting up away from your chair, and also like you're trying to stop yourself passing urine. When you've done this exercise, you need to relax your pelvic floor muscles fully. I often get asked, when can I go back exercising? When can I go back to weight training? When can I go back running? It's important to listen to your body. Generally, we recommend that you do not return to running until about 16 weeks after having your baby. The reason for this is that the hormones your body produces to make your ligaments more flexible is still present for about 16 weeks after having your baby, and for a little bit longer if you're breastfeeding. It's important to practice your pelvic floor exercises at home, and also to start some gentle exercise that is pelvic floor safe. If you need some instruction about what exercise to do, see the physiotherapist and get some guidance as to appropriate exercise that does not put any pressure on your bladder and bowel or your excessive pressure on your tummy muscles. Generally, you can start doing some abdominal exercises about 6 weeks after having your baby for a vaginal delivery, and 8 to 12 weeks after having a C-section. So when you have done your pelvic floor exercises and you feel like you're getting a little bit stronger doing the exercises at home, there are a few simple tests you can do to see, can you maintain that bladder closed when walking and adding in some jumping. Ideally, you do not want to have any pressure underneath, like pressure in your low tummy or pressure in your vagina. And also you need to make sure that you are continent and you are not having any leaking. So we can guide you as to when best to return to exercise like running or weightlifting. In the meantime, find an exercise that is suitable for the postnatal mother, perhaps a postnatal class or an easy beginner's class once you've reached your 6 or your 12-week mark.